Another fiery Senate hearing. This one starred the former CDC director, Dr. Susan Monarez. She says she was fired for supporting the scientific integrity of vaccines.
Washington correspondent Maddie Beertemple reports some lawmakers grilled her over her firing, while others expressed concern about the future of public health.
Susan Monarez served just 29 days as CDC director before the president fired her. She says she clashed with HHS Secretary Robert F. Kennedy Jr. for refusing to pre-approve vaccine recommendations without evidence and dismiss scientists without cause.
If I am put in a position of having to say, I will cede scientific integrity to retain my job, then I am not the right person for the position.
Monarez testified before senators Wednesday alongside the CDC's former chief medical officer.
I resigned because CDC leaders were reduced to rubber stamps.
Democrats expressed concern that public health is at risk under Secretary Kennedy, whose views on vaccines they worry will lead to more disease.
What is your concern if faith in vaccine science is undermined?
I believe preventable diseases will return.
But some Republicans questioned Monarez's philosophy and said it doesn't align with the administration.
You are the problem.
Kansas Senator Roger Marshall scrutinized the CDC's childhood vaccine recommendations, which an advisory panel will review at an upcoming meeting.
Your attitude here that every person needs every vaccine is completely contrary to Secretary Kennedy's philosophy and the mission of the president.
The childhood vaccine schedule has been vetted and validated through science and evidence.
In a statement, an HHS spokesperson said Monarez's remarks have, quote, factual inaccuracies and say she, quote, acted maliciously to undermine the president's agenda. In Washington, I'm Maddie Beertemple.
And for more insight into that hearing and the upcoming meeting for the advisory panel, we are once again joined by former director of the National Center for Immunization and Respiratory Diseases, Dr. Dimitri Daskalakis. Thanks so much for being back with us. We really appreciate it.
Good morning, Hillary. Good morning, Corey. Thanks for having me.
Hi. So listen, tell us what your takeaways were, the overall big picture look at yesterday's hearing.
Yeah, I think that the main takeaway is that the hearing was really, I think, a pretty big red flag. The scientific process that's really so important in making sure that the data that we're using in the United States to make vaccine policy, that process has been compromised. I think that's the main takeaway, which is that CDC's role is to review the data, to present it in a way that is disimpassioned, to have it be firewalled really from ideology and politics, and then let the discussion happen. And I think you're hearing in that discussion on the Hill just what's happening to that process, which I think is dangerous.
Let's play some sound from Susan Monarez and another person who recently left the CDC about their biggest fears when it comes to how vaccines are being approved.
What keeps you both up at night, very concisely?
The next outbreak, and I don't believe that we'll be prepared.
I'm concerned about the future of CDC and public health in our country. Given what I have seen, if we continue down this path, we are not prepared, not just for pandemics, but for preventing chronic health disease, and we're going to see kids dying of vaccine-preventable diseases.
So, Dr. Daskalakis, I've got an 18-month-old at home. We're going through the whole vaccine schedule thing. And in talking to our pediatrician, even they are saying, we don't know what's going to happen. How does everything going on at the CDC, when it comes to vaccines, when it comes to personnel, how does that play out in hospitals, in medical facilities across the country?
Yeah, I mean, in the real world, which is what matters, these aren't just, funny policy discussions. They actually manifest themselves as confusion among doctors, which is not good because that means that there's confusion among parents and patients. The other part of this is that these policy decisions have ramifications. So if there's a decision to not recommend a vaccine in a certain age, it means that that vaccine won't be covered by insurance. And that, in effect, means taking away choice and access from parents and doctors. So there's real world ramifications. And just like Dr. Monarez and Dr. Howery said, the other piece is that we may not be prepared for the next big thing, but I'm worried we're not even ready for the flu season or the COVID season based on what I'm seeing so far.
There's so much to talk about, and obviously we need to talk about COVID and the flu, but I don't like getting granular usually. But let's talk about hepatitis B and that hepatitis B vaccine.
Sure.
There was a lot of talk about that on the Hill, and I think it was Senator Cassidy who was particularly upset by this, that the idea we should wait to give it to newborns. Tell us why you think it's important.
Yeah, I mean, I think there's a very specific reason for the personal health of the baby, and then also one for just what's happening in hepatitis B in general in the country. So, infants that are infected with hepatitis B early in life, 90% of them go on to have chronic hepatitis B. That means hepatitis B forever. And 25% of them will die early, either from liver cancer, cirrhosis, which is scarring of the liver, or other liver-related complications. The birth dose historically in the United States of hepatitis B has nearly ended that, going from 20,000 cases a year down to a couple dozen. So it really means anything that shifts that birth dose away from the beginning means more opportunities for young kids to get hepatitis B, and that means liver cancer, transplants, and cirrhosis. We shouldn't really tolerate one child having to do this, since we have an intervention that's both safe and effective at that early age.
Okay, you mentioned COVID and you mentioned the flu. Not a lot of people get COVID shots anymore. Some people get the flu vaccine. What was your reaction to this whole thing, and what do you think it portends if, in fact, we're not doing the proper development and getting people vaccinated if they want it?
Yeah, thanks, Hillary. So I think one of the important things is that we generally don't make our recommendations based on popularity. So I think that what's important is that the choice is available to parents and individuals who want to get the COVID vaccine. And I think that plays out in what you're seeing in some of the states that are creating their own guidance, which, rather than constraining to make it hard to get the vaccine, based on the safety and effectiveness of the vaccine, they're recommending more open access to allow people to be able to get it. So it's not a popular vaccine for kids, but we know that kids that don't get it are more likely to get complications of COVID-19. Needless to say, the other thing that we haven't talked a lot about is long COVID. So whether they have complications in the short term is one matter, but the other matter is, for some adults, they may choose to get the vaccine so they can avoid the entire story of long COVID, which is the long-term complications of the infection. And that seems not to really be in the discussion that I'm seeing so far around some of the change in recommendations.
What do you think are the benefits, maybe even concerns, about some of these states coming together to basically create their own mini CDCs, their mini health advisory panels to sort of bypass what's going on at HHS?
Yeah, Corey, I worked at local public health in New York City, and you always look to CDC to really be like the guide, the umbrella that gives the entire country a unified perspective on how to approach health-related issues, especially vaccines. I don't like it. I don't like that states have been put in the position where, to really advocate for their people, they've had to splinter off in a way from CDC's umbrella policies. But like I said at the beginning, if the data that underpin those policies aren't the highest quality, or there's question to how well they've been vetted, or even if there's been enough time to vet them, which is, I think, one of the issues for the next ACIP, then as a local health official, you've got to do what you've got to do to keep your people safe.
So having the choice to be vaccinated is one thing. What's out of our hands is the research money and the research that's been facilitated by the federal government that now appears to be gone. For people who don't care about it, why should they? And what does a lack of research mean to all of us?
Yeah, I think one of the things that we're hearing from Secretary Kennedy is the importance for safer vaccines. Well, if you can't research to find safer vaccines, you're not going to have safer vaccines. If you don't have the money to sort of think about what new platforms could be, so new, safer, or different platforms for vaccine, you're not going to get to that finish line. So it matters if the research is gone, and also if the environment for vaccine is less conducive to companies even wanting to get into the market for doing this. What's going to happen is the pipeline is going to dry out. And I'll tell you, before I left CDC, I had my staff do a pipeline analysis. And honestly, the pipeline is dry just based on what's going on today.
All right, Dr. Dimitri Daskalakis, former director of the National Center for Immunization and Respiratory Diseases. We appreciate your time this morning, Doctor.
Thank you so much. Appreciate it.